The call to Friday prayers at Nuneaton Mosque. 2 days before the end of Ramadan, the holy month when many Muslims abstain from food and drink between sunrise and sunset. A time for piety and good deeds. And a challenging time. A time to feel empathy with those who suffer.
God has made it very clear, you see, that if we are able to fast, if you're able to, that means your health permits it, then you must try to fast so that you can understand other people without food. People, you see, who are less fortunate than you might be. What do they go through?
Ikram Haq is manager at this day centre. He's also a diabetic, facing extra challenges when fasting during Ramadan.
Can I or can I not fast? I'll see whether I can or not. So it's a matter of, trying for the first few days. Then you go into the next week, and then go to the next week. In other words, you're not giving up. But there can be a situation, there can be a time, you see, when you say, no, I can't, you see, because the sugar level is very, very low, and I got to end the fast. But I won't feel guilty in that way, because I think it's the faith that keeps you going, you see.
And it's his faith that helps community bus driver Nuneaton Sheikh to cope with his diabetes during Ramadan. He controls his blood sugar levels with exenatide, and he's got all the right tools for the job.
I have to do this 3 times a day. I just put a drop of blood in. This is the machine I use for diabetes control. It tells me what sugar level I've got in my blood. Although it is high for the level what I am, nothing to worry at the minute, because obviously it's been controlled by the injection which I take. This is the injection, right? You see, you turn this around like so. That loads the unit up. And then there's a really fine needle, if you can see it. And then once you've done that, that means you have injected yourself.
At George Eliot Hospital in Nuneaton, a diabetes team has been working closely with the local Muslim community to offer support and advice during Ramadan. The team is led by consultant Vinod Patel.
Dr. Patel, do you want to just follow me? If a Muslim patient with diabetes is fasting, it means that they can have nothing at all to eat or drink, including tablets, once dawn breaks. Then they're only allowed to have water, food, tablets again once the sun sets. We advise our patients on an individual basis on exactly how they should manage their Ramadan period, particularly in relation to drugs and the insulin. So for example, if somebody was on 18 units of insulin in the morning and 12 units in the evening, we'll swap it round to 12 units in the morning to 18 units in the evening to reduce the chances of low glucose level during the day.
Until this year, when he went on to an injected medication, Nuneaton Sheikh was able to manage his diabetes whilst fasting. Now he's had to stop, and that's difficult for a religious man.
Everybody else are doing it, your friends are doing it, your family is doing it, but you can't do it. And it's a very hurt feeling.
It's said in our scriptures as well that if it is going to be unstable for your health to do the fast, then you shouldn't be obliged to do it. So he's basically done really good, and I'm really proud of him, yeah.